Hey friends, welcome back to the channel. For those who are new, my name's Manny and I'm a fourth year medical student at McGill University. First off, let's address the obvious. I've been on a little bit of a hiatus, 1.5 years to be exact. Medical school has a way of pulling you in a million directions, but let's just say with the start of 2025, I decided that it's time to make a grand return on YouTube and I have some exciting content coming your way. Some of the video ideas I have for 2025 are tips for success in medical school with a particular focus towards clerkship, residency applications and preparation, and even some non-medical related content, maybe some educational content as well. So if that sounds good to you, make sure to like this video, hit that subscribe button, and let's get into today's topic. So today I'm diving into a topic that every future doctor has to make, and that's deciding a specialty for residency. So whether you're a pre-med exploring different career paths, you're currently applying to medical school and you want to get a little bit of a head start, or you're currently a medical student and you're a little overwhelmed with all of the options, this video is for you. Tip number 1, medicine or surgery. I think for most medical students, this is the first big fork in the road. Oftentimes, many of the subspecialties fall under the branch of medicine or surgery. There are some exceptions, of course. The medicine column includes specialties that have a focus on long-term patient relationships, as well as diagnosing, managing, or treating complex medical conditions. And some of the specialties that I would put under this column are family medicine, pediatrics, or internal medicine, and all of their subspecialties. Within the surgical column, you obviously have all of the surgical subspecialties: general surgery, orthopedic surgery, vascular, cardiac, neurosurgery, etc. These specialties are typically more procedural, hands-on, and oftentimes deliver immediate results. So obviously I don't cover every specialty using this method. I'm not talking about emergency medicine, psychiatry, pathology, radiology, etc. But generally speaking, you can kind of classify every specialty under medicine, surgery, combination of both, or neither. For me, although I started medical school thinking I wanted to be a neurosurgeon, I quickly realized that the lifestyle, the OR, the patient population was not my cup of tea. Rather, I realized that I was much more interested in diagnosing and treating complex medical patients, and as such, shifted towards internal medicine pretty early on in medical school. Tip number 2, think about your day-to-day preferences. What kind of work environment do you thrive in, or do you see yourself thriving in? Do you see yourself thriving in a clinical environment, in a hospital, in the emergency room, in the operating room, in more than one environment? Are you someone who's more interested in continuity of care, or do you prefer acute care medicine? Specialties such as family medicine and pediatrics typically involve clinic-based longitudinal care. Of course, there are exceptions to the rule. We have family doctors who work as hospitalists, or pediatricians who also work in hospital settings. Emergency medicine, on the other hand, offers a fast-paced, kind of no-strings-attached approach to care. And if you're into the team dynamics of a hospital and managing extremely sick patients, maybe internal medicine or critical care medicine is a better fit for you. Bonus tip, early on in your medical career is a great time to shadow doctors who are in a field that may interest you. It was in Med 1 where I started shadowing various subspecialties within internal medicine, and I realized that that was a great fit for me. Tip number 3, lifestyle and work-life balance. Let's be real, different specialties come with different lifestyles. Some fields like radiology or pathology might offer more predictable and more appealing hours, whereas other specialties, such as most if not all of the surgical subspecialties, offer much longer hospital-based hours with multiple on-call shifts. Of course, passion is important. If you're a career-driven person and don't mind the extra hours, surgery might be a good fit for you. On the other hand, if you're someone who's very family-oriented, has other extracurricular hobbies, or wants to have enough time to go travel and go on vacation, consider specialties that have that flexibility as well. Tip number 4, reflect on your skills and your personality. You know, there is some truth behind Dr. Glockenflecken's videos on YouTube. Every specialty attracts certain types of people. Are you a team player who loves collaboration? internal medicine might be a good fit for you. On the other hand, are you detail-oriented with a very steady hand? If so, maybe surgery is your calling. So I came to the realization that I enjoy working in teams, and I also enjoy solving diagnostic puzzles, which is why internal medicine resonated with me. Tip number 5, keep an open mind. Like I said earlier in the video, I thought I wanted to be a surgeon, and very early on in Med 1, I realized internal medicine is right for me, and I stayed true to that for the rest of medical school. Other classmates of mine thought they wanted to be medical subspecialists and then turned to surgery, and others were content with family medicine. You know, a good friend of mine told me from day one that she wanted to be a cardiac surgeon, and to this day, she is still applying to cardiac surgery. So it's not to say that if you're interested in a specialty, you're not going to end up in that specialty. But it's important to keep an open mind because you might fall in love with something else in medical school. If you're in the early stages of your medical journey, such as being a pre-med or even in your pre-clerkship years of medical school, don't stress too much about picking a specialty right away. Use your pre-med and pre-clerkship years to explore, ask questions, shadow, and by the time you reach your last year of medical school and you're applying to residency, you'll end up where you want to be. Just trust the process. And there you have it. 5 tips to help you choose your residency specialty. Whether you're just starting your medical journey or you're close to applying to residency, I hope this video gave you some clarity and some confidence moving forward. And if you enjoyed this video, give it a thumbs up, subscribe, share it with a friend so I can continue to post more content like this. Thank you so much for watching. I wish everyone a happy and healthy 2025. May all your dreams and aspirations come true. And of course, I'll catch you in the next one.